Thank you, Zoom. Hi, guys. I already started a little bit and forgot to record, which is like really, that's just me. But welcome to our Inside Music Therapy Q&A. I am Danielle. I was just saying I got my bachelor's of music and music therapy at Belmont University in Nashville, Tennessee. I met Taylor Swift at Target. It was the best day of my life. I talk about it all of the time. Joy is saying hi from back there. During my time at Belmont, I did some practicum. What a practicum is like your clinical rotation. Or if you're from an education background, like you're kind of like your in classroom learning experiences, hands-on experiences. I did those both with older adults at a memory care facility and kiddos with special needs. I also am a COVID child, so I did a telehealth practicum as well, which was an experience. I completed my 6-month internship at Children's Health in Dallas, Texas. And I have job experience across a variety of different settings: private practice, school, medical, and have clinical experience with all ages from babies in the neonatal intensive care unit all the way up to older adults in memory care. Currently, I am running my business full time, and my youngest client is 3, and my oldest client is 100. So I really like to stay. I like having a lot of different populations and a lot of different things to do. I specifically specialize in mental health. That comes from my training at Children's Dallas. I worked on their inpatient behavioral health unit, which is the place where you come for suicidal ideation, anxiety, depression, to get treatment. So I started that experience there, and then I worked on our behavioral health unit at a job here in Jacksonville for a few years. So specializing in mental health, and I now specialize in mental health outpatient as well. I founded Music Therapy Ed Now, which is a advocacy account on Instagram back in 2020. It is now run by a team of incredible students all across the country and out in Canada. And I also have the podcast, which I know Brittany said you mentioned you've listened to that, the Music to Improve and Therapy podcast. We talk a lot about music therapy, and then Music Therapy Now. So that's a little bit about me and my background. So let's get into it. What is music therapy? So music therapy is this is the definition from the American Music Therapy. Oh, hi from India. Oh my gosh. Hi, Deepa. Like literally, I don't even know what time it is in India, but so happy you're joining us. I just saw your chat. So this is the American Music Therapy Association's clinical definition of music therapy. So it's a bit of a pill to swallow, but it is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed and improved a music therapy program. Essentially, all you need to get out of that is music therapy is using music to meet therapeutic goals. We do not meet music goals like music educators use music to teach music. We use music to improve individualized goals in a variety of different goal areas, whether that's physical, mental, emotional. We'll get into that later. Music therapy interventions can address a variety of healthcare and educational goals like wellness, stress, pain, expressing feelings, enhancing memory, communication, physical rehab, etc. And we'll get more into that here in a little bit. As you can see on this cute little coffee mug, it was established in 1950. Music therapy, the origins of it have been around for a really long time. People have used music for healing forever. You can find that in so many different cultures across the world for such a long time. But it was a established healthcare field in 1950 in America, and it originated from helping war vets from World War II processing their PTSD. So, how do you become a music therapist? So, this is our little track on how to. You first apply an audition for a music therapy program, and this will be different from country to country. What I'm talking about today is America and Canada. These are the rules that we follow. So, in India, I'm not well versed in how it works over there. I'd be more than happy to do some research, but this is the American and Canadian, how we do it under the American Music Therapy Association. So, you have to apply an audition for a music therapy program. Um, and these are specific programs that have been approved by AMTA. This essentially just means that you are getting the same education as all of the other music therapists and ensures that we have a high quality education and standards. There is a list where you can find different schools here that I will drop in the chat. Um, After you apply an audition and you get in, yay, you complete a bachelor's or master's degree in music therapy. So I know a lot of people may major in psychology and music, or they may major in music education or whatever. You can do lots of different blends, but in order to get all the way here to MTBC, you have to get a degree in music therapy. And I'll talk about some of the different tracks here in a moment. You then complete 1,200 clinical training hours. So this pars up to PT, OT, so physical therapy, speech therapy, occupational therapy. We have to complete 1,200 clinical hours of training. So that is hands-on practice. Like in those practicum I mentioned earlier, that may be during your college education. So it may be while you're in classes and under the supervision of your teachers, but you also have to do a 6-month music therapy internship. This is typically full-time. It is typically unpaid. However, our field is working more to make sure there's more stipends and experiences that are maybe part-time, but like, take a little longer so they can get that training in. But it is 1,200 total clinical hours between practicum and internship. You then must pass the board certification exam for music therapists. This is under CBMT. This is what regulates our certification exam. And then you are an MTBC, yay, and you're a music therapist. So there are a few ways to get there, and these are the different degree paths that are available for music therapists. You can get your bachelor's degree in music therapy. So this is for high school graduates who are looking for a major. You can go get your degree, your bachelor's in music therapy. There's an undergraduate equivalency in music therapy, open to individuals with a bachelor's in a related subject area. So that may be education, psychology, sociology. This undergraduate equivalency is available. Now, Brittany, this one would be for you. The equivalency master's, or you can get an equivalency bachelor's, but I recommend master's in music therapy. That is open to individuals with a bachelor's in music. So this is great because there are a lot of people who may get a bachelor's degree in music and then learn about music therapy later, and all they would need in that equivalency program is those therapy classes. So that's where you're going to be taking verbal processing. It's where you're going to be taking music therapy interventions and methods. It's where you'll be taking counseling techniques, anatomy and physiology. All of the different therapy classes are addressed in this equivalency program, and as well as your practicum, your hands-on clinical experiences. And then, of course, you can go get your master's or doctorate if you have a degree in music therapy. So where do music therapists work? Pretty much everywhere, which is amazing. So some of the ones that I list here include schools, hospitals, correctional facilities, rehabilitation centers, hospice and palliative care, private practice, nonprofits, mental health. Pretty much everywhere. We work with sensitive populations, vulnerable populations, really pretty much anyone across the lifespan, across age ranges and functional abilities. So anywhere you can think of, we be there. As far as where music therapists are maybe like the highest concentration or where we're seeing the most music therapists include schools, hospitals, rehab, private practice. Okay, actually all of these. We see it a lot in all of these. I would say correctional facilities, it just depends on your area and what kind of correctional facility. I know a music therapist that specifically works in a correctional facility for women. More nonprofits have more music therapy positions. So yeah, we work everywhere. What do music therapists do? So this is a big question. It's like, cool, music therapy, yay, but what do you do? So listed here, we use evidence-based interventions to meet non-musical goals. So some things that we may do include live singing, instrument play, songwriting, improvisation, musical games, music listening, movement, relaxation, lyric analysis, adapted lessons, legacy projects. So that's a lot. As far as what like I did today, for instance, I have a guitar that I carry on my back and I use every single day. I sing, I play the guitar. I've done, I do songwriting on a daily basis, really for those clinical goals of self-expression, emotion identification. What else did I do today? I did musical games. Adapted lessons is when you're teaching an instrument, so like teaching piano, but we're using it for non-musical goals such as attention span, impulse control, cognitive processing. So we're using music for those other goals. So, music therapists do a lot, and it looks different across the settings. When I was in the hospital, I worked on a few specific units, and I'd carry a guitar on my back and I'd carry a cart of instruments. And essentially, where I heard screaming, I would go. And if I heard screaming, I would go into a room, and usually it meant a child was having a procedure done, like an IV or a port access or a dressing change. And I would go into that room and provide live music for relaxation and for pain perception. So sometimes that looked like playing Let It Go and encouraging the patient to sing with me to distract them from the procedure. Sometimes it meant playing live music to the tempo of their heart rate and slowly decreasing the tempo, and their heart rate follows. Lots of different ways that music therapy presents. We also do lots of groups. So when I was in the school setting this past semester, did a lot of games and singing, and yeah, just a lot of live music happening all the time. What goals do music therapists meet? So we have 5 goal domains, and a lot of different goals fall beneath these. So we have emotional, cognitive, communicative, physical, and social. These are our 5 domains. So for emotional, that may be decreasing anxiety and depression and helping clients express their emotions and identify their emotions through their favorite music or through talking about lyrics or through songwriting. Cognitive, this can be a lot of different goal areas as well. Cognitive processing, this is where kind of the mind body connection comes in as far as how music interacts with the brain. We have communication, so helping people to not only communicate like verbally but non-verbally, as well as helping and co-treating with speech and language pathologists. Physical, think mobility, fine and gross motor skills, walking, jumping. We work a lot with physical therapists. And then social, working on socialization, working on, sharing, turn taking if it's in a group setting, or simply engaging with other people socially. So, who do music therapists work with? So, we work with individuals of all ages and all abilities. These are just to name a few. So, I've kind of broken it down by subject matter. So, we have developmental and neurodevelopmental disorders. You have autism spectrum disorder, Down syndrome, cerebral palsy, IDD, ADHD, speech and language disorders. It is certainly not only this list. This is just a good example, some good examples. Medical and physical health conditions. So we work in the medical settings and may work in the NICU. So that is with your premature infants. We may work with individuals with cancer, chronic pain, respiratory or cardiac conditions, individuals overgoing surgery, and long-term hospitalizations, as well as neurological conditions. So we have traumatic brain injuries, strokes, Parkinson's, Alzheimer's, multiple sclerosis, help. I don't think I said that word right. And then we have mental health and behavioral health disorders, anxiety, depression, PTSD, bipolar, schizophrenia, ODD, conduct disorder, just to name a few. All right, so that's my long-winded overview of music therapy. I would love to hear your questions. So this is really all about the different questions that you have, and it can literally be about everything. I know I mentioned online, I would also talk kind of like a day in the life, so I'd be more than happy to talk about that. But I would love to hear any questions that you have. You can drop them in the chat or unmute your mic.
Okay, I'll
Let's
start.
hear it.
I
Let's.
have so many questions, but it might be more specific. I don't know. So
Oh, that's
hopefully
okay.
everyone
It'll be
else can hopefully maybe get some answers too. But
yeah.
so like I was gonna say, I'm kind of coming late, I feel like in the game of it all, right? But
No, I'm telling you, you are not alone in your
I was gonna ask, do you find more people that or maybe, are like that will transition or career change into music therapy? And
Absolutely.
yeah, so that then they go to the you said the equivalency, am I getting that
Yes,
right? Yeah.
absolutely. Yeah, so
Yeah.
my co-intern, so the person I interned alongside at Dallas Children's, this was like the craziest lore. She had a musical theater background and like was on the High School Musical soundtrack. Like she had a whole insane musical career. And she had a baby and found out about music therapy in her 30s and decided to go back to school. So she pursued her master's equivalency at Texas Women's University
Mhm.
and did her practicum and did her internship and is now working full time at a children's hospital, or I think actually an adult hospital in Houston. So it happens all the time. In my cohort, we had plenty of people come back as a second career, or maybe they've did something in music education. A lot of people make that transition and they find out about it later and come and do that. It usually takes about 2 years
Mhm.
full time for
Okay.
that equivalency program.
Yeah. Okay, cool. And that
Yeah.
includes the 6 months of,
That may be before, it may be 2 years of coursework, and then going into that 6 month internship. But I'm not 100% sure, and it really depends, especially with music education. You're gonna have so many of the credits already. So it just is, yeah, it's kind of case to case, but about 2.5 years is the range I've seen it most often. And also, if you just want to like get started and do music therapy, then a bachelor's equivalency would get you there fastest. Because you would only take those undergraduate courses as opposed to having to do a thesis and those upper level. And just a lot of people go for the master's equivalency just because they're going back to school anyway. You might as well get that master's.
gotcha. Yeah.
Yeah.
That makes perfect.
Yeah.
I know I had a couple of other questions, but
Yeah.
I'll so
We'll see if anyone else.
if anyone else wants to shout out, go for
Yeah.
it first. That'd
If
be
anyone
great.
else has any questions, drop them, or otherwise we'll shoot back to Brittany. I'm trying to think if there's any like other questions I've gotten a lot on social media, but hi.
Hi. I'm kind of in the same boat as Brittany. I got my master's in vocal performance and I'm in my late 30s and but I'm thinking about so I've been teaching for a long time. I
Yeah.
performed, taught. Then I was in nursing school for a while and I I really wanted to do nursing, but I did well with patient care and I did well with the book stuff, but I had a really hard time with the hands-on, like remembering the priming of the tubing and stuff. And so I was like, but I still, so I like ended up withdrawing, but I still want to do something with work care, with healthcare. So kind of like what Brittany was saying, like I'm like a transitioner. So I was just wondering how that works.
Okay.
Yeah, I am going back to, because I live in Pittsburgh, to Slippery Rock
Yeah,
to
yeah.
to do, but it's a post-bac equivalency.
Uh-huh.
So what do you think about that? Because I know you also mentioned masters. Does it make a difference in job preference? I mean, in hiring?
Great question. So Slippery Rock is a fantastic option because
Okay.
it is online and it, from my understanding, I haven't looked into it personally, but I believe it's one of the more financially affordable options, Slippery Rock.
Yeah.
Um,
Mm-hmm.
so and like they help you find practicum where you're already living. Like it's a fantastic option. Brittany, if you
Yeah.
look into it, look into it. Um, but as far as the post bachelor or bachelor whatever is great. In my experience, I'm at a bachelor's level. I have a lot of friends at the bachelor's level. I can't, she just popped out of nowhere, sorry. It does not.
Oh, uh,
I know she's
she's
probably
cute.
she's a
Oh,
little mutt and she's probably gonna bark here in
she's
a
cute.
minute. It'll be great. Um, it does not make a difference in the job market. The job market really comes down to experience. And for both of you, having teaching education experience with other humans, I would not be concerned.
Okay.
Now there are some jobs like the when I was at the children's hospital, if you had a master's degree, you were paid $1 more an hour.
Okay.
So, or, like some jobs you do
Please.
pay more for a master's. As far as the value, yeah. If you are
Okay.
like looking to get into it as quickly as possible, bachelor's, I think, is completely
Uh,
reasonable way to go. Yeah.
Okay. Okay. Awesome. Thank you.
Yeah.
And then how is the job prospect for music therapists, like in terms of getting a job and
Fantastic question. There are so many jobs right now, like so
okay.
many jobs. So, and I see jobs every single day in the hospital setting. I see them every day in schools and private practice. It used to be like whenever I was in school, it used to be, oh, you have a better shot at getting a job in the hospital if you have your master's. It just it's
Yeah.
just not how it is anymore because
Mhm.
um a lot of people burn out really quickly, like young professionals burn
Yeah.
out and will, leave the field. So there's just a lot of openings, and I will say that can sound discouraging. The field is going in a really positive direction right now. Our national organization is taking a lot of steps with advocacy, and we're getting a lot more recognition among the states. So like Georgia has licensure, so that means music therapists are protected. And so a musician can't call themselves a music therapist. So there's a lot of
Mhm.
advocacy going on that's really improving
Mhm.
the field of music therapy. Market,
Mhm.
lots of jobs. Now, I will say if you're in a really rural area, you may have a harder time finding a music therapy job.
Right.
But
Right.
in general, like in Jacksonville, I'm in Jacksonville, Florida, which is Northeast Florida. I can name like four different organizations, hospital, schools, private practices that all have job openings.
That's
Um,
awesome.
yeah,
Yeah.
so there's really a lot of opportunity and a lot of opportunity across the lifespan, whether it's hospice and working with older adults or medical, working with kids. That's one
Mhm.
of the great things about music therapy is there's so many options in
Mhm.
population and setting.
Okay.
Yeah.
Awesome. Thank you. That answers a lot. And thanks for having this too, because
Of
I
course.
so much is new and I start in the fall, but I am taking one summer class, abnormal psychology, which
Yeah.
starts next week, and then I'm gonna shadow someone next week.
Oh,
So I'm
awesome.
excited. Yeah. So I'm just
Fantastic.
I but it is like a whole career change,
Yeah.
but yeah, it just comes from like I said, I've done music my whole life and I was in nursing and I wanted to do something with and I thought, you know what, this is perfect because it's like something I'm comfortable with,
Yep.
and
You're gonna be excellent. You'll find
thank you.
yourself just you're gonna be utilizing so many skills you already
It
have.
was yeah.
Um,
Mhm.
and yeah, I mean, I will say like the equivalency programs, they're hard. I know you take a lot of classes and it's a big learning curve, but it's extremely worth it. I mean,
Mhm.
I think.
Yeah,
I
no, no,
mean, working
no,
in the
and it's
field. But
no.
that's so exciting. That's awesome. And I do highly recommend shadowing if you can. Brittany, come on to Jacksonville anytime. I'll take you.
Thank
I'll take
you.
you.
Yeah.
Absolutely.
That'd be fun.
Let me see what this question is in the chat. I've completed my certification program in music therapy theory based. Thinking of getting into PG diploma to become a certified therapist. Just wanted to know whether I shall opt for studying further with this certification, like how it works outside of India. Yeah, I can only speak to how it works in America. I have literally zero idea of how it works in India, but I will now educate myself. So feel free to shoot me a DM so I can get a little bit more context. Just wanted to know whether I shall opt for studying further with the certification, like how it works outside of India. Yeah, I definitely think the certification will be great. Is if it's anything like what we have here, it helps a lot with job opportunity and just ensuring that you are practicing with the the right education and knowledge that you need. If you have any more specific question on that, let me know because I don't know if I'm fully understanding or answering your question. Brittany, did you have any more questions? Oh, Kaylin. Hi, Kaylin. Go for it.
Hello. So I have just a couple of questions.
Yeah.
So so I'm a music student,
Lovely.
getting my bachelor's in music. And so I was wondering, do you know what the best option for like online music therapy programs? I've looked at a couple of them, just to
Yeah.
find them, only because I can't really like move to, I mean, we do have a program here in Charlotte, but it's in
Yeah.
a private school and I can't afford that. So that's
And that, oh
why,
yeah,
yeah, to see
there,
like if there's any great online music
yeah.
schools.
And there's a lot of conversations around that going on, because you're right, a lot of music therapy programs are housed in private universities and it's very inaccessible. It is something that the national organization is working actively towards to make more accessible. Slippery Rock is a fantastic online option. Duquesne University, it is spelled maybe like this, maybe not like that. I'd have to Google it. They also have an online program. My friend completed her master's there, so I'm not 100% sure what the undergrad level looks like, but Slippery Rock is the one that I know most about. Texas Women's University, they have a retreat style program, and it is, you can get your equivalency, and it's where you only have to be on campus like once or twice a semester, and they have some online options. So that would be worth looking into. It's been a few years since I've looked into their program though, so I'm not 100% sure what that looks like. I also am going to drop this list. It's kind of a meaty list, but don't be deterred. These are all of the programs that are AMTA approved. So let me send that. But yes, for Slippery Rock is definitely the one I know of, and it'd be good to connect.
Is that a bachelor's equivalency or a master's? Or do they have both?
I believe it's bachelor's, and Sheena, I know
Okay.
you're going there if you can speak to that, if you're still on.
Yeah.
Yeah, Kaylin, I can send you some information about that. It's really I mean, like I live maybe an hour and a half from there, but you can still do like all of it online. I mean, if like if you because you're in Charlotte, so yeah, you could still do the whole thing online, and they are really good about they can, like, when you do like practicum and stuff, they can find places in your area. Um, I will. I can email you if you want to put your email in the chat. I'll email you Vern Miller. He's the one who's in charge of the post back program. And I can get you in touch with him. And they have like rolling, like you can apply anytime. Like it doesn't matter because their fall semester starts August 25th. Um, so yeah, and they just want like, I think, what did I do? It was like really basic audition of like played three like real simple songs, played them and sang them, piano and guitar. My guitar is not very good. I have to work on that. But just so that they know you have something. And um but yeah, I really liked that it was like online and they were real flexible about placing you. So I will email you that
Thank
information.
you. That's awesome. And then I just
Hmm.
had one more question, and then anybody else can go after.
Yeah, go
Um,
for it.
so when I get there eventually,
Yeah.
pass and everything, I'm thinking about like starting my own like clinic because I
Yes.
don't know, because I'm just used to doing stuff myself because I'm a
You should.
tutor right now, so I'm a private tutor, so I'm doing stuff right now. So I wanted to know like how did you start your own practice and got clients and just kind of things like that.
What a great question. So I am brand new to all of it. I started full time this week, my music therapy business, but I've learned a lot. I actually started with my own clients a year ago. So I've kind of been slowly going into the process. It is an incredible path. If business ownership and private practice ownership is something you want to do it. You will make the most money. You will have the most freedom. You'll get to choose what clients you want and what you have. It's a fantastic option if that's something you're interested in. As far as getting started, I found mentors. So I found people. Allison Rogers of Music and Miracles has been a business owner for 7 years and worked with Kim Best, who's out in New York. The best thing is to find somebody in your area and reach out to them for coaching or mentoring or whatever. Get a good idea of what rates are in your area, what the market is like in your area, and then go from there. So, as far as finding clients, I've gotten clients through cold calling. I've gotten clients through walking in and introducing myself and handing them my brochure and telling them about music therapy. I've gotten clients on social media. So it's definitely a lot of things, and it really depends on your area. But like in Florida, for instance, we have insurance coverage through Medicaid. Medicaid covers music therapy services. We have a scholarship program that funds. Obviously, you can do private pay and different grants and whatnot. So it's definitely a great option as a music therapist. And it's not too hard to get started. I'm also working, by the time y'all are done, I'm working on I have a CMTE, like a continuing education credit coming up that is like literally step by step templates on how to start a business. So hit me up in a few years whenever you're done.
Yeah, because I have one student who I tutor for and he has autism, but she's been trying to get him into music therapy, but she said if you can get, your degree and everything, she's like, I'm gonna just stick with you so she don't have
Like
to pay
you,
like two people. Yeah, so I was like,
see,
well,
you already have a client.
yeah.
Absolutely. And like the thing is, once you get in with different circles, you get referrals. And like I have found music therapy is so needed in so many different circles. It can be easy to be like, oh, there's, it's going to be competitive, whatever. Nah, there are so many people that need music therapy services because more people are finding out about it and it's getting more validity and more research is coming out, continuing to support it. So more and more people want it for their facility, want it for their kids. So it's popping. Highly recommend. Thank you for your questions, Kaylin. And the ones I sent in the chat, Colorado State, Loyola, and Georgia College and State, those are all online programs.
Okay.
So look into those. Brittany, what were your other questions?
Actually, like Sheena asked some of them already for me, so you guys really covered the map and good questions from Kaylin too, for sure.
Awesome.
I did have a question, I guess, like, let's say, because it was a great question about, if you're gonna do your own private practice, that's a great path to go into. What do you recommend as far as, like maybe, because for me, I know I'm more that person to start out. I like to try and build experience, right? So let's
Yeah,
say it's
absolutely.
post grad, like, how do you recommend looking for jobs post grad?
Yeah.
Like Indeed, are we like, networking a bit more? Like, how does it work in the music therapy world?
All right. In music therapy world, we are tight knit. There's only 10,000 of us, and that sounds like a lot, but it is not. We are all in Facebook groups. So
Mhm.
whenever you become a music therapist, you're going to get in Music Therapists Unite, and you're going to get in music therapy jobs and hiring.
Mhm.
So whenever I found there's always jobs on Facebook. They're on LinkedIn, they're on Indeed. Like, yes, you can find them all there, but we are such a small, tight-knit community. I've gotten all my jobs from personal connections. So people that you meet during school, your professors, like my school's still, I'm in a Facebook group for like Belmont Music Therapy, and they send jobs in there all the time. Or Instagram, like whatever. I mean, I get DMs and post them up on Instagram as well periodically. So it's really kind of like word of mouth and social media, but also those typical kind of LinkedIn, Indeed, all of that. And it really depends on your area. Like I would recommend find it like if there's a music therapist, there's you said Fort Lauderdale, right, Brittany? I can
Mhm.
get you in contact with like 12 there. So getting in contact with music therapists in your area will be really helpful just so you network and get to know what the music therapy scene is like in your area. And then hopefully they can help connect you to jobs or offer you a job or have you come right along and observe all that.
Great. Oh, awesome. Well, thanks for the advice. I appreciate that for sure. I know, and I noticed, Sheena, you said that you're going to shadow someone too. So I like the idea of that. Definitely gonna
Yes, that's a
frame
fantastic
that
idea.
way. Yeah.
It
For
helps too just to like get a better idea of what it is because music therapy is one of those things that's a little hard to understand until you're doing it. Like even for me, it kind of took me a while before I was like, oh, that's what that is. So I really recommend definitely checking it out and seeing a session in real life.
definitely. Would
Yeah.
you mind telling us? I know you said maybe if we had time about what day in the life is.
Yeah, absolutely. Okay, so I'll start. I've lived a few different music therapy lives. So I'll start with my most recent life of working in the schools. Um, went down a bit. You're totally fine. That's fantastic. I definitely think that certification would be well worth the investment, Deepa. Sorry, I'm like squirrel. I saw the message and I got distracted. Okay, so day in the life. So this past semester, I was working for a nonprofit who provided music therapy services to the public schools here in Jacksonville. So as far as a day in that life, I was doing that. I was doing that 13 hours a week. It was 25-minute groups. So I would be at a site for 1 to 2 hours, and I would do 25-minute groups with kids with special needs. I had pre-K groups all the way up to kids with special needs who are 22 years old and in transition programs. So I was doing that, and I had like 6 clients of my own that I was seeing in my private practice. So I was doing about 20 hours a week of clinical work. That included driving to the schools and driving to clients' homes. So I do all like in-home / like in facility music therapy. So a day in the life for me on let's call it a Tuesday, I would go to a school. My car is packed with instruments. I have a guitar, I have a keyboard, I have a cart of egg shakers, tambourines, rhythm sticks, whack sticks, movement props, so like stretchy bands or scarves. Trying to think, visual aids, so with like emotions or with things to help with communication. And I would unload my cart and I'd put my guitar on my back, and I had specific classes that I would go to. So I'd go and I would do 25-minute sessions. So that session typically looked like a hello song. So we'd sing hello to Brittany, it's time for music today. And then we would like point to how we're feeling that day for emotion identification. So we'd start there. I then would pass out instruments. So an intervention I used a lot was a shake my sillies out intervention. I'm gonna shake, shake, shake my sillies out. And we would do things like shake high, shake low, shake right, shake left, and that would promote active listening. That would promote impulse control, other things that my almost 8 p.m. brain can't think of right now. So we work on different things like that. And we'd also do games to promote like turn taking and socialization. And we would do songwriting activities to promote self-expression. So it would be like kind of fill in the blank songwriting activities. And then we would sing, maybe do like a movement prop and then sing goodbye. And I'd go and repeat that with some of the different groups. Then I would go, let's do to an individual session with a teenager with anxiety and depression. Those are my faves. I love angsty teenagers. And that looks very different than your school-aged group. So for them, I do a lot. We usually would chit chat and talk kind of like updates about who's getting in fights at school that day and what mom did to piss me off yesterday. We talk about those things. And then we will do a lyric analysis. So lyric analysis is when we take your favorite song. My favorite song is Mirror Ball by Taylor Swift. We would take it, print it out or put it on my iPad, and we would listen to it and look at the lyrics, and we would underline, circle, highlight any of the lyrics that stuck out to us. And we would take those and talk about them. So what did she mean by this lyric? What are the main themes in this song? What emotions are coming up? And usually that would be tied back to, well, this lyric, she talks about feeling like having to put on a mask, and I feel like I'm having to do that a lot with my mom right now. And we would talk, okay, how, what exactly, how are you doing that? What does that look like? And how can we build some coping skills and deal with that? Sometimes that also may turn into songwriting. And I'm really big with like songwriting and recording process. So I've done several sessions where we'll write a song, we'll record the song with my recording equipment, and then we'll like make a music video. And it's great for self-expression and alleviating that anxiety. So that may be what a session looks like with that teen. So I would do schools, go to that teen, and then I'd go to a different school and do those groups again. However, if I had older kids, it would focus more on social skills. They were really preparing on like for different jobs to go out in the community. It would focus on different things like that. We do like guess that song. We were doing like somebody requested Cheetah Girls, which I was like shocked they knew who the Cheetah Girls were. Yeah, for like Beyonce and all kinds of music. So really, especially in my life where I have a 3-year-old to a 100-year-old, I'm doing like Elvis Presley and Cocomelon the same day. So yeah, that's like a day in the life of this kind of school private practice life. If we're going back to the hospital, which I know we had some medical interest here, I worked specifically on the hematology oncology unit, so blood disorders and cancer, all childhood. And then I was working in a children's hospital, and then behavioral health. So suicide, depression, anxiety, homicide, and some like behaviors. So for that, I would go in, walk into the hospital, park really far away, and they make you shuttle because hospitals are annoying like that sometimes. So I'd go in and I would go and sit in my desk. We were a part of the Child Life Family Support Services uh program. I don't know if program's the right word, but I'd go in and sit at my desk and I would pull up my census. So the census is like, the medical system that tells you everyone that's in the hospital. And I would go and click on my specific units and my specific floors. There were typically frequent flyers. So kids who were battling cancer, a lot of the times they're in and out or they're in the hospital for long periods of time. So I knew um, I would specifically prioritize clients with long hospital stays because a lot of my goals revolved around coping with hospitalization. So I would look at the census and see who's still here, and then I would see what consults were in. So the nurses knew to consult for pain perception. So were their clients really struggling with pain? Is there a procedure that day that they really need music therapy support? Is that a long-term stay, or is there bereavement? So I did a lot of end of life and bereavement in the hospital as well. So I'd look for those consults. I would read the charts and kind of get an update on that day. And then I would take my cart with all the same things I told you earlier and my guitar on my back. And I would go walk the halls and I would go to that hospital room. I'd go in, I would talk to parents if they were there, and then I'd work with the child. And those sessions could be anywhere from a 5-minute check-in to 2 hours. It really just depends. There's no schedule like there is kind of on the outside world. There were, when I was in behavioral health, I had specific groups that I would do at certain times, but on like a general medical unit, it's like kind of a free for all as far as timing and who you see. So that included live music, playing guitar at the bedside. Sometimes it included them showing me their favorite songs. Sometimes it was songwriting and recording. At end of life, we do heartbeat recordings. So this is where we go in with a recording special stethoscope, and it records the heartbeat. You go and edit it to make sure you can get all of that background noise out and edit it to be continuous. And then we would put it in teddy bears with like a little heart device. So it's kind of like Build-A-Bear. Whenever you press it, you would hear the child's heartbeat in the bear. And then we would also put them together with songs. So if their favorite song was "You Are My Sunshine," the heartbeat would be the drum beat to that song. So did a lot of legacy building and recording projects in the hospital end of life as well. So yeah, I would do that all day. As far as the hospital, I would see sometimes 4 clients, only 4, because they're lengthier, or sometimes I'd see 10 because I was doing a check-in and a really quick procedure and different things like that. So caseload and all of that kind of just depends and looks pretty different. Okay, that was long-winded. Any other questions based on that specifically? We have a couple more minutes until we wrap up.
I
Then
have
you
a
have to
question.
chart all of that, which is the worst part. Okay, sorry, Caitlin, go.
That was okay. So I had a question. So like I said, I am a music student and doing on all the theory and oral skill classes. So I wanted to know, from your perspective, do you use a lot of theory and oral skills in your practice? Because I just wanted, because I am
Because
struggling
it's
with it.
awful. I know.
Yeah, because that's why I was asking. Like, do you actually use that in music therapy? I just wanted to
Such a
know.
great question. Yes, I use it functionally. So, for instance, I go into a hospital room and their favorite song is something I've never heard in my entire life. And they really want to play it. They want to learn it on ukulele, or they want to sing it. When you go, you listen, you figure out the key, and you figure out, is it 1 4 5 4 5? You figure out the chord progression, and you go back in there and you do it. So in those terms, that's whenever you use it. Or sometimes in like adapted lessons, if I'm teaching a kid piano and they want to learn the Minecraft theme, being able to listen and figure out what keys are being played and being able to notate that really quickly, those are important. It ain't like you're not like transposing, complex compositions and anything like that, but like the basics of being able to transpose, like being able to play "You Are My Sunshine" in C, D, E, F, G, A, B, C, right? Like being able to play it in every key, being able to play by ear, like those are the important things, but not so much like, I'm going to play you a melody and you have to notate it like that, not so much. Well, actually kind of, I don't know. Sorry, I'm rambling a little bit, but important, yes. You'll make it through, but you will never use those like theory 4, oral skills 4 stuff again. It won't be that hard. And
Okay.
the internet's amazing too, so it'll help you.
Okay.
Yeah.
I just wanted to know because I was like, oh God, like, do I
I
really need
know,
this?
I know it's so hard. I had one of my best friends failed oral skills 4 like 3 times, and she is a thriving music therapist. So don't worry. You can fail it and still be a great music therapist.
I think that's it. I don't think I have
Awesome.
anything.
Yeah, I'll take one more question if anyone has one.
One more. What was your like main instrument in music therapy? Because I like singing was primarily mine and then piano. My guitar I'm working on, but it's definitely my weakest.
Yeah.
So what are your recommendations for like getting more comfortable with guitar and learning that?
So primary was voice, same. I had very limited guitar skills going into school. I use it
Mm-hmm.
every single day now. And I'm not like I ain't here like shredding nothing. I call myself a functional musician. Like I can play the guitar, I can play bar chords, I can I can pick, I can do basic picking patterns. Um I can do everything I functionally need to play Let It Go or play Elvis Presley or play Coco Melon. Um so but like it's not, I'm not doing things beyond that. So it's every single, I swear to God, unless it's your primary instrument, every single music therapist has that like guitar fear and like it's so scary and I don't know how to play it, but it's just you'll get a lot of time to practice. You'll get thrown into sessions where you just got to figure it out. So as far as recommendations, being able to play just basic keys, like being able to play 1 4 5. I don't know if that translates. Does 1 4 5,
Yeah.
y'all know what that is? Does that make okay?
Mhm.
Okay. I went to school in Nashville and some of the things they taught us don't isn't like
Uh,
universal. So if you can play 1 4 5 and C and G, that is a great place to start.
okay.
Um, as far as like basic songs, I would recommend being able to play and like just like practicing. I'll type here. Very basic stuff. You Are My Sunshine. Um, Shake It Off by Taylor is a really easy one. What's another easy? Love Me Tender is kind of hard. I'm not going to give you Love Me Tender. But just like, basic. Hold on. Can't get my brain's not working. Can't help falling in love. Twinkle. Twinkle. Play in keys of C and G. This is a good starting point.
Yeah.
Do
Okay.
not
No, no, no.
fret.
Thank you.
One
I'll
day
make
you'll be like, ugh, I can play whatever.
No, no, no. And then how about like strumming patterns? So I know like when I was talking to Slippery Rock. I mean they'll teach us that, but
Mhm.
just as like a way to get started, because I can play like basic guitar, like I like basic things, but I'm really rusty, so I'm just like trying to get like
Yeah.
20 years ago I took lessons.
Right? No, no,
uh,
absolutely.
but they said one thing I could work on was strumming patterns. So was there like a certain um probably YouTube that could
Yeah. Here, I'm going to give you this. So there is a guy named Riffs with Ryan, and he's on Instagram.
okay.
And he is a music therapist who specializes in guitar and is teaching music therapists how to play guitar. And
Really?
he has a free thing next Wednesday that I'm going to. And
Oh,
he has free tutorials online. And he's literally like music therapy guitar for music therapists.
oh,
So
that's amazing. Okay.
highly recommend. Yes.
Okay.
He
I
would be a great
know.
resource.
Awesome. Thank you.
Absolutely. Awesome, guys. Well, I
Mm.
think we're going to wrap up right there. Thank you all so much for spending this evening with me. I really appreciate it. I'm going to throw this back up here. If you're not already, follow me on social media. Um, I always try to answer DMs, but as you can imagine, being business owner, there's like a billion and 10 things I'm doing all the time. So I can't always get to them and like answer in depth, but you are more than welcome to always contact me. Um, And I do offer mentoring and consulting which you can find on that QR code right there. If you would like to have more in-depth conversations, that's my email, it's my phone number, Insta, website, whatever you need. I'm here for you
Mhm.
guys. And I'm really excited that y'all are considering music therapy. I highly recommend. It is amazing. Like any job, there's its days, but it is mostly overall amazing and is incredibly fulfilling.
Mhm. Thank you so much for hosting. And
Absolutely.
this was really helpful because I going into the field and like I said, being a performance major, I just didn't know too much. This was really helpful. And I follow you on Instagram and I love it. I
Thank you.
thought it
No,
was,
I appreciate it. I'm so
mhm.
glad it was helpful. And any feedback you have, like what other information could have been helpful or what wasn't helpful, I'm always open to feedback. So I appreciate it.
Yeah, thank you so much. I mean, this is you really covered everything, especially for I think maybe I could speak for a basic, if you're really
Yeah.
interested in and appreciate you being real too on, what they go into and all the advice. So it's
Always.
really nice to meet you and
Lovely meeting you.
definitely hope to stay in touch. Hope to stay in touch with everybody. Hey, we can make a group, guys.
Yeah. Oh my God. Everyone drop their Instagram handles if you want.
Right.
Um, can stay in touch that way. Absolutely. Brittany, make sure to send me a DM so we can connect since we're
Yeah,
neighbors-ish.
definitely for sure, right? I know. I was nervous my pup was about to go smack onto this computer screen too, but no, I feel like I there.
Let me see. Oh, hi. Stop. That's so freaking cute. How
She's
cute.
like, why did you bother me right now? But yes, thank you so
Oh,
much. It was so nice meeting everybody else too. I wish everybody like good luck on your adventures too. And
Thank
definitely
you. You too. And Katie, I'll email you as soon as we're done. I'll email you the information about Slippery Rock.
Okay, thank you.
No problem. No problem.
thank you guys. Have a great night.
Thank you.
Happy
You
almost Friday.
too.
Yes. Thank
Thanks so
you.
much.
Of
Thank
course.
you.
Bye.
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 Bye.